At 3:58 on a Thursday morning in late August, Dr. James Sullivan's forceps emerged from the incision behind Sarah Mitchell's left ear, holding something that made his hands freeze for the first time in 15 years of emergency medicine. It was pale, segmented, alive. The thing writhed in the surgical light, approximately 3 centimeters long, its body contracting and expanding as if searching for the warmth it had just been torn from. Clear fluid dripped from barbed appendages that had anchored it deep in Sarah's tissue. In the metal basin below, it curled once, twice, then went still under the harsh fluorescent glare. Sarah's breath caught. The nurse stepped backward. The monitors continued their steady beeping, indifferent to the horror. "What?" Sarah's voice cracked. "What is that?" Dr. Sullivan didn't answer. He was staring at the incision site where something else had just begun to move. "There's another one," he whispered. Leave a like and share your thoughts in the comments along with the city you're watching from now. Let's continue with the story. 6 weeks earlier, on a Friday afternoon in late August, Sarah Mitchell stood in front of her kindergarten classroom at Riverside Elementary School, her blonde ponytail swinging as she demonstrated the letter M for the third time that day. 23 5-year-olds watched with varying degrees of attention while she traced the letter on the whiteboard with exaggerated movements. "Mountains have peaks," she said, drawing each hump carefully, just like the letter M. At 28, Sarah had been teaching for 7 years, long enough that the motions had become second nature, the patient repetition, the colorful skirts that made her approachable, the handwritten notes she sent home to parents every Friday. Her classroom reflected her personality, alphabet charts she'd made by hand, a reading corner with mismatched bean bags she'd collected from garage sales, and a goldfish bowl where Bubbles III swam in lazy circles. She lived alone in a studio apartment in Portland's Pearl District, paying $1,400 a month that stretched her teacher's salary uncomfortably thin. The breakup with Jake 6 months ago had been mutual, civilized, and left her lonelier than she'd expected. Her routine filled the gaps: coffee at 6, school by 7:30, yoga on Tuesday and Thursday evenings, Sunday mornings at the farmer's market. Jennifer, Jen to everyone, was 3 years younger but had functioned as Sarah's second mother since their parents' divorce when Jen was 15. Now a registered nurse working night shifts in OHSU's emergency department, Jen lived 15 minutes away and visited 3 times a week, usually bringing takeout and unsolicited advice in equal measure. Her red hair and freckled face made her look younger than 25, but her eyes carried the particular weariness of someone who'd seen too much suffering on the night shift. Their father, Robert Mitchell, remained a distant figure in both their lives. At 72, the Vietnam veteran lived alone in Gresham, 40 minutes east of Portland. He called once a month, conversations rarely lasting more than 5 minutes. Sarah had long ago stopped expecting more from him. When she thought about it at all, she attributed his distance to the same thing that had ended his marriage to their mother: an inability to connect, to be present, to show affection in any way that mattered. She didn't know about the locked filing cabinet in his basement or the medical records from 1969 that he sometimes pulled out at 3 in the morning when sleep wouldn't come. The decision to go camping came during a particularly exhausting first week of school. New students cried at drop-off, parents flooded her inbox with questions, and paperwork seemed to multiply overnight. When Jake texted on Thursday asking to talk about things, Sarah felt something inside her snap. She needed distance, space, silence. That evening, she scrolled through camping blogs until she found what she was looking for: a site along the Deschutes River in central Oregon, described as a hidden gem with peaceful isolation and no crowds. Perfect. "You're going alone?" Jen's voice carried concern through the phone. "I need this," Sarah said. "Just me and nature. Let me come with you. I can switch my shift. Jen, I'll be fine. It's 2 nights." The next morning, Sarah packed her tent, sleeping bag, a novel she'd been meaning to read, and her journal. On the kitchen counter, she left behind the bottle of insect repellent she'd meant to grab. In her closet, the mosquito net remained folded, forgotten. She arrived at the campsite Friday evening just as the sun began its descent toward the mountains. The location lived up to its description: beautiful, isolated, with only 2 other campers visible in the distance. She set up her tent near a grove of trees where the shade would keep her cool, not realizing the canopy also provided perfect breeding ground for insects. After a swim in the cold river that left her skin tingling and refreshed, she built a small campfire and settled into her camping chair with her journal. The mosquitoes arrived with the dusk, buzzing around her ears and neck. She swatted them away absently, too relaxed to care much. When she finally retreated to her tent, she left the windows open to catch the breeze. Saturday brought a 5-mile hike along the river trail. The beauty of the landscape, towering pines, the rush of water over smooth stones, the absolute quiet broken only by birdsong, justified every mile of the drive. She felt several bites on her neck and behind her ears throughout the day, scratching them without much thought. Everyone got mosquito bites while camping. That night, more insects found their way into her tent. She applied afterbite cream to the worst of them before sleep, noting in her journal, "Beautiful trip, but bugs were aggressive." Sunday morning, she packed up and drove home, already planning her return to the ordinary rhythm of the week ahead. After a long shower that washed away 2 days of campfire smoke and trail dust, she noticed a small bump behind her left ear while towel drying her hair, just a mosquito bite. It would fade in a few days. The following week passed in the familiar chaos of teaching kindergarten. Monday through Wednesday blurred together in a haze of alphabet lessons, playground supervision, and parent-teacher conferences. The bump behind her ear remained, growing slightly larger, but Sarah attributed it to scratching in her sleep. She was too busy to give it much thought. Thursday, a colleague noticed. "You okay? You keep touching your ear." Sarah dropped her hand, embarrassed at the unconscious gesture. "Just a bug bite from camping." By Friday, the bump had grown to the size of a marble. When she touched it, warmth radiated from the center. She mentioned it to Jen during their evening phone call. "Probably infected," Jen said, her voice tired from a long shift. "Try a warm compress tonight." Over the weekend, Sarah attempted every home remedy she could think of: warm compresses, antibiotic ointment, tea tree oil. The bump refused to shrink. On Sunday evening, while examining it in the bathroom mirror, she noticed a small dark spot in the center that hadn't been there before. It looked almost like an opening. She told herself it was probably an ingrown hair and went to bed. At 1:47 Monday morning, Sarah woke to a sensation she couldn't name. Not exactly pain, pressure. Behind her left ear, rhythmic, like a heartbeat, but separate from her own pulse. She reached up and touched the bump. It had grown overnight to the size of a golf ball, hot against her fingertips, throbbing with each beat of that foreign pulse. In the bathroom, harsh light revealed angry red skin stretched, shiny, and tight. The dark spot in the center was definitely an opening now, a small slit in her flesh. As she stared, unable to look away despite her rising nausea, the skin around the opening moved. Something beneath the surface shifted. Sarah leaned closer, her breath fogging the mirror. A pale, thread-like structure emerged from the opening, barely a millimeter, then retreated back inside. She jerked backward, her shoulders slamming into the doorframe. Her hands shook as she grabbed her phone. It was 2:03 in the morning when she called her sister. Jen arrived in 8 minutes, a trip that should have taken 15. Sarah heard the keys rattle at the door and opened it to find her sister still in scrubs from her shift. Medical bag in hand, face set in the professional mask Sarah recognized from hospital visits. "Show me," Jen said. In the bathroom, Under unforgiving fluorescent light, Jen examined the lump with gloved hands. Her fingers pressed gently around the edges, testing. Sarah watched her sister's face for reaction and saw what she'd hoped not to see, concern flickering beneath the professional composure. "We're going to the ER," Jen said. "Now." "It's 2 in the morning. Maybe we should wait." "Sarah." Jen's voice left no room for argument. "Pack a bag." The emergency department at Oregon Health Science University Hospital hummed with the particular energy of late-night crisis. Fluorescent panels cast harsh light across plastic chairs where 6 other people waited. A man clutching his chest, a mother with a feverish toddler, an elderly couple speaking in quiet Spanish. A television mounted in the corner murmured weather updates that no one watched. At the check-in desk, a tired receptionist took Sarah's insurance card and handed her a clipboard. Sarah filled out forms while pressing gauze to her ear, the fabric already dampening with clear fluid that seeped from the opening. Each question felt surreal. Date of birth, current medications, reason for visit. The triage nurse called her back after 20 minutes. Blood pressure, 145/90, elevated from her normal 110/70. Temperature, 99.8. The nurse asked her to remove the gauze. When she saw the lump, her professional expression faltered for just a moment. She made notes on her tablet. Possible abscess, suspected foreign body. She marked Sarah's chart yellow. Urgent but not critical. Back in the waiting room, Jen held Sarah's hand. They didn't speak. Sarah watched the clock. 2:47, 2:58, 3:15. The gauze grew wetter. A man with chest pain was called back before her. Protocol, she understood. Heart attacks took priority over lumps. CNN played on the television, cycling through stock market futures and traffic accidents. The coffee machine wore an out-of-order sign. On a bulletin board, flyers advertised flu shots and support groups. The clock ticked audibly in the quiet moments between announcements. At 3:42, a nurse led them to exam room 7. Dr. James Sullivan looked younger than Sarah expected, maybe 32, with tired eyes that suggested he was deep into a long shift. Navy scrubs hung loose on his thin frame. He introduced himself while reviewing her chart on a tablet, then pulled up a rolling stool and sat at her eye level. "Tell me about your recent travel," he said. Sarah explained the camping trip. 2 weeks ago, Central Oregon, Deschutes River area. Sullivan nodded. "Insect exposure fits. Let me take a look." His examination was methodical. Gloved fingers palpated the lump gently, testing its borders, the heat radiating from it. Sarah winced despite trying to stay still. He measured it, approximately 4 centimeters in diameter, and noted the fluctuance, the way fluid seemed to shift beneath the skin. "Most likely an abscess," he said, "possibly a sebaceous cyst with secondary infection. We'll numb the area, make a small incision, drain it. Pretty straightforward procedure." "What about the movement she felt?" Jen asked. Sullivan's expression remained neutral. "Fluid shifting under pressure can create that sensation. It's a common misperception with abscesses." Sarah wanted desperately to believe him. Just drainage, antibiotics. Home by sunrise. A nurse arrived with a tray bearing instruments Sarah tried not to examine too closely. Syringes, a scalpel, gauze squares, a metal basin. Sullivan explained each step while drawing lidocaine into a syringe. The injection burned for several seconds before numbness spread through the area. He waited 5 minutes, tested the anesthetic with a probe. "Feel this?" He pressed against her skin. "Just pressure, no pain." "Good. Let's proceed." The nurse positioned the metal basin beneath Sarah's ear to catch the drainage. Jen stood beside her, one hand on Sarah's shoulder. Sullivan leaned in with the scalpel, his movements precise and controlled. The incision was small, barely 5 millimeters. Sarah felt pressure but no pain as the blade parted skin. Clear, yellowish fluid began to ooze from the opening immediately, trickling into the basin. The smell hit her, sharp, sour, undeniably biological. "Good," Sullivan murmured. "Draining well?" He stopped mid-sentence. Sarah watched his face change. The professional mask cracked. He leaned closer, frowning, then straightened slightly as if to get better perspective. The incision site pulsed, not fluid draining outward, something pushing from inside. Sullivan's hand moved quickly to the instrument tray. He selected forceps with the automatic precision of someone whose training overrode shock. A pale shape began emerging from the opening, thin, segmented, approximately 2 millimeters wide. "What the?" Sullivan caught himself, gripped the structure with the forceps, applied gentle traction. It resisted. Sarah felt the pulling sensation deep in her tissue despite the numbness, felt something anchored that didn't want to release. Sullivan maintained steady pressure. The nurse stepped closer, eyes widening. The sound came suddenly, wet, tearing, tissue separating. The larva emerged fully, 3.5 centimeters long, pale cream in color, its segmented body writhing in the forceps grip. Sullivan dropped it into the metal basin where it landed with a soft clink against stainless steel. It moved, curled, uncurled, searched blindly for warmth it had just lost. Sarah gagged, bile rising sharp in her throat. Jen's sharp intake of breath broke the silence. Sullivan stared at the specimen, 5 seconds passing before anyone spoke. The nurse backed up a step, hand pressed to her mouth. Sullivan cleared his throat, forcing himself back into doctor mode despite the tremor Sarah noticed in his hands. "Okay, that was unexpected." He paused. "This appears to be a larva, possibly botfly species." "Botfly?" Sarah's voice came out strangled. "How?" "Rare but documented in Oregon. Your camping exposure fits the pattern." As he spoke, the incision site moved again. The color drained from Sullivan's face. He irrigated the wound with saline, aimed a pen light into the cavity, looked deeper than Sarah wanted to imagine. "There's another one," he said quietly. The room tilted. Sarah gripped the armrests of the exam chair, knuckles white. Jen's hand tightened on her shoulder. Sullivan reached in with the forceps again. This larva was smaller, 2 centimeters, a younger stage perhaps, and came out more easily, less anchored in tissue. It joined the first in the basin. 2 pale bodies now writhing together. The nurse covered the basin quickly with gauze, as if hiding them would undo what they'd all seen. Sullivan stood, pulling off his gloves. "I need to call ENT. Ear, nose, and throat. A specialist. This is beyond emergency department scope." To the nurse. "Start an IV. Antibiotics, ceftriaxone, 2 grams. To Sarah. "We're admitting you. How many more?" Sarah's voice barely rose above a whisper. "I don't know," Sullivan said. "We need imaging, CT scan immediately, and, likely, surgery." It was 4:15 in the morning. The longest night of Sarah Mitchell's life had only just begun. At 5:30 in the morning, a radiology technician wheeled Sarah through empty hospital corridors to the imaging department. An IV line ran from her left arm, antibiotics dripping steadily into her bloodstream. She'd never been in a wheelchair before, never felt this particular flavor of helplessness, awake, aware, but unable to control what was happening inside her own body. The CT scanner dominated the small room, a massive donut of white plastic and machinery. The technician was young, probably mid-20s, and kept up a steady stream of cheerful conversation that Sarah appreciated despite her terror. He explained the procedure while positioning her on the sliding table, placing foam blocks around her head to keep it perfectly still. "You'll hear some loud humming and clicking," he said. "Just stay as still as possible. Should take about 8 minutes." The table slid her into the machine's opening. The space felt smaller than she'd expected, the walls of the donut impossibly close to her face. Loud mechanical sounds filled the air, humming, clicking, whirring. Sarah closed her eyes and tried not to think about what the machine might be seeing. How many more of those things might be coiled beneath her skin? They injected contrast dye halfway through. She felt it immediately, a strange warmth flooding through her veins, a metallic taste coating her tongue. The technician's voice came through a speaker. "You're doing great. Almost done." 8 minutes felt eternal. Back in the ER bay, curtained but not private, Sarah lay on the gurney while Jen sat in the plastic chair beside her. The IV beeped its steady rhythm. Beyond the curtain, the sounds of the emergency department continued. Monitors beeping, doctors being paged, a child crying somewhere distant. Clock on the wall read 6:15. Outside the small window, sunrise was painting the sky pink. At 7 o'clock, Dr. William Henderson arrived. The ENT specialist looked to be in his late 40s, with gray touching his temples and kind eyes that carried the weight of 2 decades of practice. He pulled up a rolling stool and sat at Sarah's eye level, a gesture of respect she noticed even through her fear. On a tablet, he pulled up her CT scan, the cross-sectional images of her skull showing in stark grayscale. "These are the images we took," he said, turning the screen so she could see. He zoomed in on the area behind her left ear, pointing to dark pockets visible beneath the skin's surface. These cavities were created by the larvae. Each one represents a separate organism. Sarah's throat tightened. "How many?" Henderson's finger traced the screen, counting. "I see 6 distinct cavities, possibly 7. There's some shadowing here that makes it difficult to determine if this is a separate cavity or an overlap." The math hit her like a physical blow. 2 removed, 6 or 7 remaining. Total of 8 or 9 larvae that had been living inside her head, feeding on her tissue, growing. "We need to do surgery," Henderson continued. "Today, general anesthesia. I'll explore the tissue layers systematically and remove all larvae we can identify." "All you can identify?" Jen caught the qualifier immediately. Henderson met her eyes, nurse to doctor. "CT scans have limitations. If 2 larvae are very close together, they can create overlapping shadows. And there's always the possibility of one being too small to show clearly on imaging." He explained the risks with the same gentle honesty. The larvae were close to the mastoid bone. If infection spread there, it could reach the brain. Proximity to facial nerves meant potential for temporary or permanent paralysis of facial muscles. The surgery would need to be meticulous, time-consuming. "I've consulted with infectious disease," he added. "Cases like this are rare but documented." "We've prepared as thoroughly as possible." Sarah signed the consent forms with shaking hands. The words blurred together. Risks, benefits, potential complications. She initialed beside each warning, each acknowledgement of what could go wrong. Jen stepped into the hallway to call their father. Sarah heard her voice through the curtain, sharp with frustration. "Dad, it's serious. She's going into surgery today. I know it's early, but—" "Okay, fine. Yes, I'll call you after." When Jen returned, her expression told Sarah everything. "He can't make it today," Jen said, voice flat. "He said he'll call after the surgery." Sarah nodded, not trusting herself to speak. The hurt was old, familiar. Her father's distance had been a constant throughout her life. She'd stopped expecting him to show up years ago, but still it stung. By 9 o'clock, Sarah had been moved to the pre-operative holding area. The IV medications had increased, Antibiotics, anti-nausea drugs, something for anxiety that made her thoughts feel like they were moving through honey. A nurse had clipped the hair around her left ear, apologizing with each gentle snip. The surgical gown was thin and cold. Jen hadn't left her side in 14 hours. Still wearing yesterday's scrubs, hair pulled into a messy ponytail, eyes red from exhaustion and worry. What if they can't get them all? Sarah asked the question she'd been avoiding. Jen's nurse training kicked in, giving honest answers even when they hurt. Then you'll need another surgery. What if one's too deep? Jen paused. They'll do their best. It wasn't the reassurance Sarah wanted, but it was real. Sarah's hand found her sister's. I should have asked you to come camping. I should have insisted, Jen said. This is my fault. I ignored the symptoms for weeks. Stop. Jen's voice was firm. You couldn't have known. But Jen's eyes carried something Sarah couldn't quite read. Guilt, maybe? Or regret? Years of being sisters meant Sarah could tell when Jen was holding something back, but the pre-op medication was making it hard to push, hard to ask the right questions. The anesthesiologist arrived at 10:30, a calm woman in her 50s who explained the process with practiced ease. Sarah would go to sleep, wake up in recovery, remember nothing in between. Standard questions followed. Allergies, previous surgeries, family history. The anesthesiologist made notes, nodded, but Sarah saw her glance at the chart more than once. This case was unusual enough to warrant extra attention. At 11:30, Robert called back. Jen answered, walked into the hallway. Sarah heard fragments of conversation through the gap in the curtain. Jen's tone shifted from frustrated to resigned. When she returned, her face was carefully neutral. Dad said he'll call after, Jen reported. Sarah felt the familiar ache of paternal absence settle in her chest, joining the physical pain radiating from behind her ear. Two different wounds, one visible and one not, both eating away at her from the inside. At noon, the surgical team arrived, efficient, friendly, professional. Time to go. Sarah's last coherent thought before the sedatives began to take hold was a question she couldn't answer. Would she ever feel normal again? The operating room doors closed at 12:15. Jen found herself alone in the surgical waiting room, surrounded by strangers and their private anxieties. 12 other families scattered across plastic chairs, some crying, some staring at nothing, some trying to distract themselves with magazines they clearly weren't reading. HGTV played on a wall-mounted television, showing people renovating houses with problems infinitely simpler than the one happening in the operating room. She bought coffee from a vending machine. It tasted like burnt cardboard, but the caffeine was necessary. She'd been awake for 26 hours. The first hour crawled. Jen tried to read a book she'd grabbed from her car, but the words refused to form meaning. She checked her phone every few minutes despite knowing they wouldn't call this soon. Around her, other families were called one by one. Mr. Johnson's family. He's out of surgery. But never her name. By 1:15, she was pacing. 6 laps around the perimeter of the waiting room, other families watching her with the recognition that comes from shared suffering. An elderly woman finally spoke. First surgery is always the hardest to wait through. Thank you, Jen managed. She didn't mention what they were removing, didn't explain that her professional knowledge made this worse, not better. As a nurse, she knew every complication that could be happening behind those doors. Infection spreading to bone. Facial nerve damage. Anesthesia complications. The list her mind generated was endless and specific. At 2:20, a nurse in surgical scrubs emerged. Ms. Mitchell? Jennifer Mitchell? Jen shot to her feet. Your sister's surgery is going well, the nurse said. It's taking longer than initially expected, but everything is under control. Dr. Henderson estimates another hour. What does longer than expected mean? The nurse training made Jen's questions precise, technical. They're being very thorough, complex case. I can't give you more specifics, but she's stable. The subtext was clear to Jen's professional ear. They'd found more larvae than the imaging suggested. The third hour was torture. Jen's mind, trained to understand medical procedures, constructed detailed scenarios of what might be happening. Henderson would be working layer by layer through tissue, identifying each larva, extracting them carefully to avoid leaving any fragments behind that could cause infection. If they were near the facial nerve, every movement would need to be millimeter precise. Too deep near the mastoid bone meant risk of the infection tracking inward. She knew too much. Ignorance would have been easier. Her phone buzzed, a text from Robert. "Any news?" She typed back. "Still in surgery. Will update when I know more." No response. The anger rose hot in her chest. How could he not be here? How could he leave Sarah to face this with only Jen beside her? But beneath the anger lay something else. Understanding she didn't want to acknowledge. She'd noticed over the years how their father reacted to hospitals. The way his hands shook, the way he found excuses to leave, the nightmares he'd mentioned once years ago, before changing the subject and never bringing them up again. Something had happened to him, something he'd never explained. Inside the operating room, time moved differently. Sarah lay unconscious on the table, propofol having taken her under as she counted backward from 10. She'd reached 7 before darkness claimed her. A breathing tube extended down her throat, ventilator providing each breath with mechanical precision. Monitors beeped steadily. Heart rate 82, blood pressure 118/76, oxygen saturation 99%. Her head was turned to the right, the left side of her face and ear completely exposed. Sterile blue drapes covered everything except the surgical field. Orange betadine antiseptic marked the area in widening circles. Dr. Henderson stood at the head of the table, Dr. Sullivan assisting. The younger doctor had requested to observe and learn. 2 scrub nurses managed the instrument trays. The anesthesiologist monitored vital signs from her station. At 12:45, Henderson made the first incision. His scalpel traced a vertical line, 4 centimeters long, following the postauricular approach. Skin parted cleanly. Yellow subcutaneous fat became visible beneath. Bleeding was minimal. The cautery device sealed small vessels with brief touches that left the smell of burnt tissue in the air. The first cavity appeared immediately, a dark pocket in the tissue. Henderson worked carefully, using forceps to widen the opening. The larva was right there, 4.2 centimeters long, pale and segmented. He grasped it with surgical precision and applied gentle traction. It resisted. Barbed spiracles, breathing structures that looked like tiny hooks, had embedded themselves in the surrounding tissue, anchoring the larva in place. Henderson maintained steady pressure. The wet tearing sound as tissue separated made Sullivan's jaw tighten, but he held the retractor steady. The larva emerged, writhing in the forceps. Henderson dropped it into a specimen cup. 1 down. By 1 o'clock, they'd found the second and third larvae. The second was deeper, near the muscle layer, taking 5 minutes of careful dissection to free. Blood welled up. The nurse suctioned it away. The third larva was smaller, younger, only 2.1 centimeters, and came out more easily. 3 extracted. The team worked in focused silence, only speaking when necessary to request instruments or report vital signs. The fourth larva, found at 1:35, presented the first serious challenge. It was located posteriorly, very close to the mastoid bone. Henderson probed carefully with a curved instrument. This one was the largest yet, 4.5 centimeters, and had anchored itself to the periosteum, the thin covering of bone itself. "Retraction," Henderson said quietly. Sullivan adjusted his angle, giving better visibility. The dissection required 12 minutes. Each movement had to preserve the integrity of the bone covering while separating the larva's barbed structures. Henderson's hands were rock-steady despite the delicate work, despite the sweat visible on his forehead above the surgical mask. When the larva finally came free, it writhed more vigorously than the others, as if protesting its removal. 4 down. At 2:10, they found the 5th in a mid-layer cavity. Standard extraction, but the tissue around it showed more damage than the others, signs of where it had been feeding. Henderson irrigated the area thoroughly with saline, checking for any remaining fragments. Then, at 2:25, while exploring what should have been the final cavity, Henderson discovered the 6th larva almost by accident. The CT scan's overlapping shadows had hidden it. It was the smallest yet, only 1.8 centimeters, tucked near the facial nerve. The neuromonitoring system highlighted the nerve in yellow on the screen, a warning that any slip could cause permanent facial paralysis. Henderson's movement slowed to millimeter precision. The room held its collective breath. Xiao's 3 minutes of careful work freed the larva without touching the nerve. 6 extracted. The specimen cup now held half a dozen pale bodies. At 2:40, Henderson turned his attention to the deepest area, against the mastoid bone itself. The CT scan had suggested a possible 7th cavity. The bone showed slight elevation, consistent with pressure from a larva creating space. He probed carefully, irrigated with saline, explored with a curved instrument designed for reaching difficult angles. Empty. He checked again, approaching from different directions. Nothing. No larva visible. "I don't see another organism," he said to the team. "Could have been a shadow artifact on the CT scan, or possibly a deceased larva that the body already absorbed." The decision point: keep searching and cause more tissue trauma, or accept that 6 living larvae removed might be the complete count. "We'll close," Henderson decided. A Penrose drain was placed to allow fluid to escape during healing. The closure proceeded in careful layers: muscle, subcutaneous tissue, skin, 18 sutures total. A pressure dressing secured everything in place, protecting the surgical site. At 3:10, the anesthesia was reversed. Sarah's body began breathing on its own. The breathing tube was removed. Her eyes fluttered but didn't open, still too deep in chemical sleep to be truly conscious. They wheeled her to the post-anesthesia care unit at 3:15. In the waiting room, Jen's phone buzzed. A text from the surgical nurse. "She's out. Doctor will be out to speak with you shortly." The relief was physical, weakening her knees. She sat down hard in the plastic chair and let herself cry for the first time in 15 hours. At 3:30 in the afternoon, Sarah Mitchell drifted toward consciousness through layers of chemical fog. The first sensation was her throat, dry, raw, the residue of the breathing tube making each swallow feel like sandpaper. Then came the pain, dull and throbbing behind her left ear, spreading across the side of her head in waves that pulsed with her heartbeat. A face swam into focus above her. Jen's features, blurry at first, then sharpening. Her sister's eyes were red-rimmed, her hair falling out of its ponytail. "You're out," Jen said, and her voice cracked on the second word. "You're okay." Sarah tried to speak, but her throat wouldn't cooperate. A nurse appeared, offered ice chips. The cold was a mercy. She managed 3 words. "Is it over?" Before Jen could answer, Dr. Henderson arrived, still wearing surgical scrubs, a surgical cap covering his gray-touched hair. He pulled a rolling stool to her bedside and sat at eye level, that same gesture of respect he'd shown before. "The surgery went well," he said. "We removed 6 larvae, all intact specimens, sent to pathology for analysis." 6. Sarah's foggy brain tried to process. But you thought 7. Imaging suggested 7 cavities, Henderson explained, his voice gentle. We found 6 living organisms. The 7th cavity may have been empty. Sometimes the scans show shadows that aren't separate pockets. Or it could have contained a deceased larva that your body had already begun to break down and absorb. Even through the morphine haze, Sarah understood what he wasn't saying. But you're not completely sure. Henderson met her eyes with the honesty she was beginning to associate with him. Based on what we could see during the surgery, we're confident we removed all living organisms. But medicine rarely deals in absolutes. I explored the area thoroughly. If there was another living larva, I would have found it. The word "if" hung in the air between them. So, maybe one more, Sarah said. Maybe not. The tissue showed no additional signs of active infestation. Your body is already beginning to heal. He paused. We'll monitor you closely. Any sign of continued infection or new symptoms we'll address immediately. Sarah wanted to ask more questions, but exhaustion pulled at her like a physical weight. Her eyes closed mid-thought. When she opened them again, Henderson was gone, and the light from the window had changed. Evening, then. Hours had passed in what felt like seconds. The morphine carried her in and out of consciousness through the early evening. Each time she surfaced, Jen was there, reading or scrolling through her phone, or just sitting with one hand resting on Sarah's arm. Monitors beeped their steady rhythm. Beyond the curtain, the sounds of the post-operative ward continued, nurses speaking in low voices, other patients calling for help, the wheels of medication carts rolling past. At 11 o'clock that night, a nurse checking vital signs frowned at the thermometer reading. You're running a fever, she said. 101.8. Sarah felt it then, the chill that made her shiver despite the blankets, the sweat dampening her hospital gown, the way the pain behind her ear had intensified from dull ache to sharp throb. The nurse pressed the call button. Within minutes, more staff arrived. A different doctor, the hospitalist on call, examined the surgical site. The dressing was changed. Redness extended beyond the incision line, and the drainage was cloudier than it should have been. We're starting broad-spectrum antibiotics, the doctor said. IV push, and I want her monitored more closely. At 1 in the morning, Sarah was transferred to the ICU. The intensive care unit meant constant surveillance, a nurse visible through the glass wall at all times, vital signs checked every hour, machines monitoring every bodily function. The fever climbed to 102.3, then 102.8. Jen sat in the chair beside the bed, no longer trying to hide her fear. At 3 o'clock, Sarah's fever peaked at 103.2 degrees. In the space between sleep and waking, consciousness blurred by fever and medication, she felt it, movement behind her ear, not imagination, not phantom sensation, real, undeniable movement beneath the bandage. She screamed. Nurses rushed in. Jen grabbed her hand. Sarah's free hand clawed at the bandage, trying to reach whatever was still inside, still alive, still feeding. "There's more," she gasped. "I can feel it moving. It's still there." "It's the fever," Jen said, but her voice shook. "You're okay. There's nothing there. I can feel it." A sedative entered her IV line. The world softened at the edges. But even as consciousness slipped away, she swore she felt that rhythmic pulsing, that sense of something foreign moving beneath her skin. When morning finally came, the medical team made a decision. At 6 o'clock, they performed an ultrasound of the surgical site, rolling the probe carefully over the bandaged area while Sarah held perfectly still, terrified of what the screen might show. The ultrasound revealed a small fluid collection, a seroma, the radiologist explained. Normal after surgery. Pockets of clear fluid that would reabsorb on their own. No evidence of any residual organism, no signs of continued infestation. The infection was bacterial, likely from the tissue trauma, not from any remaining larva. They adjusted her antibiotics, adding vancomycin to cover resistant bacteria. By noon, her fever had dropped to 101.5. By 3 in the afternoon, it reached 99.8, nearly normal. Her consciousness cleared like fog lifting. The phantom movement sensation faded, leaving only the real pain of healing tissue. She was going to survive this. At 6 o'clock that evening, while Jen was in the hallway getting coffee, Sarah heard a voice she hadn't expected. Her father's voice. "I need to see Sarah Mitchell," Robert Mitchell said at the nurse's station. Jen's response carried down the corridor. "Now you show up? 2 days later?" Sarah's heart clenched. She couldn't see them, but she could hear every word through the thin walls of the ICU room. "I couldn't," Robert's voice cracked. "I needed to." He stopped. Couldn't finish the sentence. "She needed you," Jen said. And Sarah heard the anger, the exhaustion, the protective fury of a younger sister who'd been holding everything together alone. Surgery, fever, scared out of her mind. Where were you? Is she okay? Physically, yes. Emotionally? You should ask yourself that question. A pause. Then, "Can I see her?" "I don't know if she wants to see you." Sarah's emotions tangled, anger at his absence, longing for his presence, confusion about why he'd come now. Through the glass wall, she watched Jen and Robert appear, saw her sister's rigid posture, saw her father's weathered face, looking older than she remembered. He was carrying something, a small metal lockbox, dented and worn. Jen stepped aside, reluctantly. Robert entered the room and stopped just inside the doorway, as if uncertain of his welcome. Sarah met his eyes and saw something she'd never seen before in her father's face. Not just guilt, but fear. Raw, undisguised fear. Neither of them spoke. 30 seconds passed. Robert's jaw worked as if trying to force words out. Sarah waited, unwilling to make this easier for him. Finally, he spoke. "I'm sorry I didn't come sooner." "Why didn't you?" The question came out harder than she'd intended. Robert's fingers tightened on the lockbox. He took a breath, let it out slowly. "Because I've been where you are." Sarah blinked. "What?" He moved closer, set the lockbox on the bedside table with careful precision. His hands shook slightly, a tremor Sarah had attributed to age but now wondered about. 1969, he said. Vietnam. Mekong Delta. The words made no sense. Sarah's fever-addled brain struggled to connect them to the present, to the larvae, to anything that made sense. "What are you talking about?" Robert opened the lockbox. Inside, yellowed papers rustled. He pulled out a document with the careful reverence of someone handling something both precious and painful. Military medical records, a faded photograph of a young soldier Sarah barely recognized, dog tags that clinked softly against metal, a Purple Heart medal, tarnished from decades in darkness. "I need to tell you something," Robert said. "Something I should have told you years ago." His voice carried the weight of 55 years of silence about to break. Outside the window, the sun set over Portland, painting the sky in shades of orange and red. In the ICU room, father and daughter faced each other across a distance measured not in feet, but in decades of unspoken pain. And in a dented metal lockbox, the evidence of a parallel nightmare waited to reshape everything Sarah thought she knew about her father. Robert's hands trembled as he lifted the first document from the lockbox. Yellowed paper, edges soft with age, official military letterhead, barely legible after 55 years. U.S. Army Medical Report, Saigon Field Hospital, September 1969. "I was 21, he began, his voice rough. "Infantry. We'd been on patrol in the Mekong Delta for 7 days. Monsoon season, hot, humid, insects everywhere." He paused, staring at the paper as if the words there could help him continue. "Everyone got bitten. Mosquitoes were constant. You learned to ignore them." Sarah watched her father's face, seeing him not as the distant figure who'd defined her childhood but as a young soldier, barely older than some of her former students' parents. Day 5. I felt a bump on my shoulder. Dismissed it. Day 12. I collapsed during a mission. Fever. Delirium. His jaw tightened. The medic took one look and called for immediate medevac. They flew me to the field hospital in Saigon. He pulled out a photograph, black and white, creased. A young man in hospital scrubs, shoulder heavily bandaged, eyes hollow with shock. Sarah barely recognized him. "The surgeon found 9 larvae," Robert said. The number fell like a stone between them. "Botfly. Same species you had. They extracted 8 during surgery." "And the 9th? Sarah's voice was barely above a whisper. "Too deep. Near the shoulder joint. The surgeon said removing it risked permanent nerve damage to my arm. Could have left me unable to use it." Robert's hand unconsciously moved to his left shoulder. He made the call. "Leave it." Said it would die on its own. Get absorbed by the body. The silence stretched. Outside the ICU room, monitors beeped. Someone's alarm went off down the hall. Normal hospital sounds that felt impossibly distant. "For 55 years, Robert said, and his voice finally broke. "I've felt that 9th one. Every single day. Doctors say it's impossible, that it died decades ago, that it's just scar tissue, that what I feel is phantom pain, PTSD manifestation, they call it." He looked up, met Sarah's eyes. "But I feel it move. I know what they say. I know the medical facts, but I feel it." Understanding crashed over Sarah like a wave. Her 7th cavity, his 9th larva, the same uncertainty, the same terror of something that might still be inside, alive or dead or imagined. "When Jen called and described your symptoms," Robert continued, I knew exactly what you had, and I couldn't," his voice caught, "I couldn't come to the hospital, couldn't face it, because seeing you there would mean facing everything I've spent 55 years trying to forget." "Dad!" "Your mother left because of this," he said, "because I couldn't explain the nightmares, couldn't tell her why hospitals make my hands shake. Couldn't explain why I'd wake up at 3 in the morning convinced something was crawling under my skin." He gestured at the lockbox. "I never told anyone. Not her. Not you girls. Soldiers don't talk about bugs. About fear. About feeling violated by something you can't even see." Sarah's throat tightened. All those years of distance, of feeling unloved, of thinking her father simply didn't care, recontextualizing in an instant. "I'm sorry," Robert whispered. "I should have been there. But I was terrified that if I saw you in that hospital bed, I'd—" He couldn't finish. Sarah reached out, found his hand. It was shaking. "I didn't know. How could I have known?" "You couldn't?" Robert pulled another document from the lockbox. Printed pages, recent. "When Jen told me where you'd been camping, I started researching. CDC database of parasitic cases, looking for patterns." He spread the papers on the bed. Maps. Medical reports. Sarah tried to focus through the lingering effects of fever and medication. "Where exactly did you camp?" Robert asked. "Deschutes River, near Maupin." The color drained from Robert's face. He fumbled in the lockbox, pulled out a military training map, folded and refolded so many times the creases had worn thin. His hands shook harder as he opened it. 1967, he said. "Before Vietnam deployment. We did survival training at—" His finger traced a route on the faded map. "Deschutes River area. Fort Stevens was base camp, but they sent us out for 2 weeks. Field training. Living off the land." Sarah's pulse quickened. That's where I camped. Within 5 miles of your site." Robert's voice was hollow. "I got infected during training. Not Vietnam. I always thought it happened in the jungle, but the medical records—" He tapped the yellowed paper. "The timeline doesn't match. The larvae were already established before I deployed. I brought them to Vietnam with me." The impossibility of it settled over the room like a physical weight. The same location, the same parasite, father and daughter, 57 years apart. "How?" Sarah breathed. Robert pulled up research on his phone, hands still trembling. "Climate change. Botflies are tropical, but their range is expanding north. 1967 had an unusually warm summer in Oregon. Isolated outbreak, 2024. Same conditions, same result." Sarah's mind reeled. "But the camping blog—" "I found the site from a blog recommendation." "Whose blog?" She grabbed her phone from the bedside table, pulled up the saved page. "Author name is Thomas Garrett." Robert's face went white. "Tommy. You know him? He was in my squad. Trained with me at Deschutes. Got infected the same time I did." Robert's voice was barely audible. "He died 5 years ago. Cancer." The web of connection tightened around them. A dead soldier's widow maintaining a blog as memorial. Sarah, unknowingly following his recommendation to the exact location that had infected both him and her father. A circle of trauma closing across decades, connecting 3 people through invisible threads of coincidence that felt too precise to be random. No supernatural force, no cosmic intervention, just the terrible mathematics of chance, climate, and geography converging to create a pattern that looked like fate. Sarah stared at her father. This man she'd thought she knew, this stranger whose pain she was only now beginning to understand. His 9th larva and her 7th cavity. His 55 years of phantom movement and her terror that something still lived beneath her skin. "I feel it too," she whispered. "The movement. They say it's phantom pain, nerve damage, but I feel it." Robert's eyes filled. "I know. God help me, I know." On August 30th, 4 days after surgery, Dr. Henderson returned with the pathology results. Sarah had been moved from ICU to a regular room, her fever gone, the infection responding to antibiotics. She sat propped against pillows while Jen worked on her laptop in the visitor's chair, catching up on nursing continuing education modules she'd been neglecting. Henderson pulled up a chair, tablet in hand. "Pathology confirmed what we suspected. Dermatobia hominis, human botfly. All 6 specimens were intact, which gave them excellent tissue samples for analysis." "So it's definitely gone," Sarah said. It wasn't quite a question. "The organisms we removed are definitely gone," Henderson clarified with the precision she'd come to expect from him. "But there's something interesting in the genetic analysis. The larvae show slight variations from the standard South American strain, possibly a North American adapted variant." Sarah's stomach tightened. "What does that mean for me?" "Nothing immediately concerning. You're healing well. But the CDC has requested samples for epidemiological research. These cases are rare enough that each one helps us understand how the species is adapting to new environments." The word CDC carried weight Sarah hadn't anticipated. By that evening, somehow, hospital staff talked, or maybe someone in pathology mentioned it to a friend. A local news reporter had called the hospital asking for an interview. Local teacher survives rare parasitic infection would make a compelling human interest story. Sarah refused, but she couldn't stop the whispers, couldn't prevent colleagues from texting concerned questions, couldn't control the spread of information in an age when nothing stayed private. On September 2nd, a CDC epidemiologist called. The conversation lasted 40 minutes, detailed questions about her camping trip, exact dates, specific activities, any other symptoms. Sarah found herself reliving the trauma with each answer, her hands shaking by the time she hung up. The epidemiologist's conclusion provided minimal comfort. Isolated case, low public health risk, but we're flagging the area for monitoring. 2 weeks later, Sarah learned that the Oregon Parks Department had posted warnings at Deschutes River campsites. Advisory notices about protective measures against insect-borne parasites. She felt a complicated mix of guilt. She'd ruined that beautiful location for others, and something else. "You may have saved lives," Robert said when she mentioned it during one of his daily phone calls. "Someone else going there now will take precautions, will pack repellent, will notice symptoms early." It was the first time Sarah had considered her nightmare might have purpose beyond her own suffering. On September 8th, Jen brought Sarah's accumulated mail to her apartment. Sarah had been discharged 3 days earlier, released to recover at home with strict instructions about wound care and follow-up appointments. The stack included medical bills that made her stomach churn, get-well cards from colleagues and parents of her students, grocery store circulars, and one official envelope with the Department of Veterans Affairs seal. Sarah stared at it, confused. "Why is the VA writing to me?" She opened it, read the first paragraph, then the second, but the legal language refused to make sense. Words like dependent eligibility and service-connected condition and retroactive coverage floated past her comprehension. "Let me see," Jen said, and Sarah handed it over gratefully. Jen's eyes widened as she read. Her nursing work meant familiarity with VA paperwork, with the complicated web of benefits and eligibility. She read it twice, then looked up at Sarah with an expression caught between shock and something that might have been tears. "Your application was approved," Jen said slowly, "as a dependent of a disabled veteran with a qualifying service-connected condition." "I don't understand." "Dad's 1969 parasitic infection was classified as service-connected. That extends benefits to direct descendants for related conditions." Jen's voice shook slightly. "Sarah, they're covering all your medical expenses, retroactive to your ER admission." The numbers swam in Sarah's vision as Jen read them aloud. Emergency room visit, $4,200. CT scan, $3,800. Surgery, $47,000. ICU stay, $22,000. Medications, follow-ups, all of it totaling $81,000. Her teacher's insurance, with its high deductible, had covered $38,000. Sarah's responsibility, $43,000. Nearly a full year of her $48,000 salary. She'd been facing bankruptcy, payment plans that would stretch for years, the constant weight of debt crushing her ability to breathe. The VA coverage, $43,000. Complete, total, zero balance remaining. "He did this," Sarah whispered, staring at the letter. The date on the application approval, August 27th, the day of her surgery. But the filing date, she found it in the small print, August 26th, the day she was admitted. While she was in the ER having larvae extracted while she was terrified and in pain, Robert had been working through VA bureaucracy. He'd stayed away from the hospital because he couldn't face it. but he'd fought for her in the only way he knew how. Sarah's hands shook as she dialed his number. It rang 3 times before he answered. "Sarah, everything okay?" "I got a letter from the VA." Silence on the other end. Then, "Good. That's good. You did this. You filed the paperwork while I was in surgery. Had to do something." His voice was gruff, uncomfortable with gratitude. "Couldn't just sit there. Couldn't walk into that hospital. But I couldn't do nothing either. Dad, you—" Sarah's voice broke. "Thank you. I don't even have words." "You're my daughter," Robert said, and his voice carried an emotion Sarah couldn't remember ever hearing from him before. "What else would I do?" They stayed on the phone for 20 minutes. The longest conversation Sarah could remember having with her father since childhood. When she finally hung up, she realized she was crying. 2 days later, on September 10th, Jen came over for dinner. They'd fallen into a comfortable routine. Jen checking Sarah's surgical site, Sarah cooking something simple, both of them pretending everything was normal while they adjusted to a new reality where nightmares could be removed but uncertainty remained. They were watching television, some home renovation show neither was really following, when Jen suddenly spoke during a commercial break. "I need to tell you something." Sarah turned, recognizing something in her sister's voice. "What's wrong?" "I was supposed to go camping with you." The words came out in a rush, as if Jen had been holding them back for weeks. "You asked me." "I said yes." "Then the day before I called and canceled." Sarah's mind rewound, tried to remember. The details were foggy. Pre-crisis memories felt like they belonged to a different person. "I thought I always planned to go alone." "No. I bailed." Jen's eyes were shining with unshed tears. "There was an overtime shift available. Extra $450. My student loan payment was due. I needed the money. So I chose money over you." "Jen, if I'd been there, I would have made you use repellent. I would have noticed the bites sooner. I would have insisted on seeing a doctor after 3 days, not 16. Jen's voice cracked. "You went through this because I chose a paycheck over my sister." Sarah reached for Jen's hand. "Stop. You should be angry. I understand if—" "I'm not angry." Sarah squeezed her sister's fingers. "How could you have known?" "I should have been there. You couldn't have predicted this." "No one could have." Sarah's voice was firm. "And you know what you did? You sat with me for 14 hours in the ER. You slept in an ICU chair for 3 nights. You've checked my wound twice a day for 2 weeks. You've been here for every moment that mattered. But if I'd just—" "No." Sarah pulled Jen into a hug, felt her sister's shoulders shake with released guilt. "We can't think like that. We can't torture ourselves with what-ifs. I ignored symptoms for over 2 weeks. I didn't pack repellent. I camped in an area I didn't research properly. If we're assigning blame, there's plenty to go around." They held each other for a long moment, 2 sisters carrying different versions of the same guilt, finally allowing themselves to set it down. "You didn't abandon me," Sarah whispered. "You saved me." When they pulled apart, both were crying. But something had shifted. The guilt that had been eating at Jen since that first panicked phone call at 2:03 a.m. finally began to release its grip. Not completely, guilt rarely disappeared entirely, but enough to breathe. Outside Sarah's apartment window, Portland prepared for autumn. Leaves were beginning to turn, the late summer heat finally breaking. Inside, 2 sisters sat together in the comfortable silence that comes after confession, after forgiveness, after the kind of crisis that either breaks families apart or binds them closer together. They had chosen binding. On September 20th, 6 weeks after surgery, Sarah returned to Dr. Henderson's office for her follow-up appointment. She sat in the examination chair, fingers unconsciously touching the thin pink scar behind her left ear, mostly hidden now by hair that had grown back. Henderson examined the incision site with careful attention, palpating the area gently. "Healing beautifully," he said. "No swelling, no heat, no signs of infection. The scar will continue to fade over the next year." "I still feel pressure sometimes," Sarah admitted. "Like something's there." "Phantom sensation," Henderson explained. "The nerves are healing. They're sending confused signals to your brain. It's completely normal after this type of surgery." "How long will it last?" Henderson's honesty hadn't changed. Months, sometimes years. For some patients, always. The brain has a memory of trauma. It takes time to forget. The MRI had been scheduled for that afternoon. 30 minutes in the machine, the familiar sounds of humming and clicking, the claustrophobic tube that Sarah had learned to tolerate. When Henderson showed her the results an hour later, the screen displayed cross-sections of her skull in grayscale clarity. "No residual masses," he said, pointing to the area behind her ear. "No active infection. You're clear." Sarah asked the question she'd been holding. "So the seventh cavity was empty?" Henderson chose his words carefully. "The imaging shows no evidence of any remaining organism. Whether there was ever a seventh cavity, or whether it contained viable tissue, we can't say with absolute certainty. But medically, you're healed." Sarah understood what he meant. She would never have complete certainty. Just like her father, she would live with probably and most likely instead of definitely. It was a truth she was learning to accept. On October 1st, Sarah returned to Riverside Elementary. 5 weeks absent. The longest she'd been away from her classroom since she started teaching. A substitute had filled in, and the room felt subtly wrong, furniture rearranged, her careful organization disrupted. But when the students arrived that morning, their excitement erased everything else. "Miss Sarah, you're back!" 23 5-year-olds crowded around her, a tsunami of enthusiasm and questions. Sarah knelt down to their level, accepting hugs, answering queries. "Where were you?" a girl named Emma asked. Sarah had prepared this answer. "I had ear surgery, but I'm all better now." "Did it hurt?" "Yes, but the doctors were very good at helping me feel better." "Can we see?" Sarah smiled. "It's covered by my hair. Nothing exciting to look at." The morning passed in the familiar rhythm of kindergarten. Circle time, alphabet practice, story hour. But during the afternoon science lesson, Sarah's carefully maintained composure cracked. She'd planned to teach about butterflies, had hung a poster showing the life cycle: egg, larva, pupa, butterfly. The diagram of the larva stage, segmented body, small and pale, was too close. Sarah froze mid-sentence, her breath catching. Her hands began to shake. The students didn't notice. She forced herself to continue, but her voice wavered. By the time the final bell rang and parents collected their children, Sarah's professional mask had worn dangerously thin. In the principal's office afterward, she made a decision. "I need to talk to someone." "A therapist." The principal nodded without surprise. "The school has counseling services through our health plan. I'll set up the referral." "Thank you." Sarah's voice was quiet. "I thought I could handle it alone." "Asking for help is handling it," the principal said gently. The first therapy session came on October 8th. The diagnosis, mild PTSD, manageable with cognitive behavioral therapy, felt both validating and frightening. Real enough to have a name, treatable enough to have hope. The triggers were identified: insects, medical shows, camping imagery. Treatment would include gradual exposure therapy, techniques for managing anxiety, tools for distinguishing real sensations from phantom ones. Progress would be slow, but it would be real. On October 15th, Sarah invited her father to dinner, the first time she'd initiated contact in longer than she could remember. "Can you come to my place, Sunday at 6?" Robert's surprise was audible through the phone. "You sure?" "Yes, please come." She cooked pot roast, his favorite from childhood memories she'd almost forgotten. When he arrived, carrying a bouquet of grocery store flowers that made her throat tight, the awkwardness was palpable. Years of distance didn't dissolve in an instant. They were two people learning to know each other for the first time. Over dinner, Robert brought out his old photo album. Vietnam-era pictures she'd never seen. His squad, young men barely into their 20s, Thomas Garrett grinning in fatigues, a jungle camp that looked simultaneously beautiful and terrifying. He told stories, carefully selected. Not combat. He still couldn't talk about that. But human moments. The time Tommy tried to cook rice over a camp stove and started a small fire, the chaplain who did magic tricks with playing cards. The letters from home that everyone shared, reading them aloud because connection mattered more than privacy. Sarah learned her father as a young man, scared, brave, flawed, human. Finally, she asked the question, "Do you still feel the ninth larva?" Robert's honesty hadn't changed. Every day. Does it get easier? You learn to live with it. It becomes part of your story, not the whole story. Sarah understood. She would carry this too. The seventh cavity question, answered or not, would always be part of her. Before Robert left, Sarah made a request. "Can we do this again? Next Sunday?" "I'd like that," Robert said. His voice carried emotion he'd spent decades learning to hide. "I'd like that very much." The seasons changed. Autumn arrived, then winter. Sarah continued therapy, facing triggers gradually. She returned to hiking in November, short trails, well-populated, always with a friend, not camping yet, maybe never camping, but reclaiming some of what had been taken. Weekly dinners with Robert became routine, awkward at first, then easier. They were building something new, different from what they'd lost, perhaps better because it was honest. Jen completed her nurse practitioner program in December, specializing in infectious disease. Sarah's case had changed the trajectory of her career, given her purpose beyond general emergency medicine. She was studying parasitology, tropical medicine, preparing to help future patients who might face similar nightmares. On January 15, 2025, Sarah stood in front of her classroom during morning circle time. The topic for the week was overcoming challenges, and she'd decided to share something personal. "I want to show you something," she said, pulling her hair aside to reveal the thin scar behind her ear. "Last year, I got very sick. Doctors helped me get better. It was scary." 23 pairs of eyes watched with the solemn attention children give to important truths. A boy named Lucas raised his hand. "Were you afraid?" "Yes, very afraid." Emma asked, "How did you be brave?" Sarah paused, considering. "I had people who loved me. My sister stayed with me at the hospital. My dad helped me even though hospitals scared him too. And good doctors knew how to help." "Are you all better?" Lucas asked. Sarah smiled. "Mostly. Sometimes I still feel a little scared, but that's okay. Being brave doesn't mean not being scared. It means doing hard things even when you're scared. And asking for help when you need it." The lesson continued. Age-appropriate stories about bravery, about facing fears, about the importance of family and friends, and asking for help. Simple truths that Sarah was only now fully learning herself. After school, alone in her classroom, Sarah graded papers at her desk. Her hand drifted unconsciously to the scar, felt the familiar flutter of sensation, real or phantom, it no longer mattered. She breathed deeply, using the technique her therapist had taught her. In for 4, hold for 4, out for 4. Outside her window, winter afternoon light painted the playground in shades of gold. The alphabet charts on her walls, the reading corner with its bean bags, the goldfish bowl where Bubbles the Fourth swam in peaceful circles. All evidence of life continuing, of normalcy rebuilt. Her phone buzzed. A text from Robert. "Dinner Sunday? I'll bring dessert." Sarah smiled and typed back, "Perfect. See you then." She returned to her grading, peaceful in a way that had nothing to do with certainty and everything to do with acceptance. Some wounds never fully healed, some questions never got answers, but she could still teach. She could still love. She could still build a life worth living, even with uncertainty woven into its fabric. The scar behind her ear would fade but never disappear entirely. Neither would the question of the 7th cavity. Neither would her father's 9th larva, phantom or real after 55 years. These were the stories they carried, the weight they learned to bear. But bearing weight didn't mean being crushed by it. It meant learning to stand upright, to move forward, to choose life and connection and hope, even when the ground beneath felt uncertain. Sarah Mitchell gathered her papers, turned off the classroom lights, and locked the door. Tomorrow would bring new students, new lessons, new moments of ordinary miracle that made up a teacher's life. Tonight, she would go home to her small apartment, make dinner, call Jen, maybe watch something mindless on television. Normal life, scarred life, good life. She touched the scar one final time, then let her hand drop. The sensation fluttered and faded. Real or imagined, it no longer defined her. She walked into the winter evening toward whatever came next, carrying her uncertainty like a stone that had been polished smooth enough to hold without cutting her hands, healed enough, living fully, finally, blessedly, home. Sometimes it takes a crisis to show us what really matters. Sarah's story reminds us that the walls we build between family members, whether from silence, shame, or simply not knowing how to connect, can come down when we're brave enough to be vulnerable. Robert carried his trauma alone for 55 years, convinced that real strength meant suffering in silence. But when his daughter faced her own nightmare, he learned that love isn't always showing up in person. Sometimes it's fighting battles behind the scenes, doing paperwork at midnight, using your own pain to spare someone else's. The most powerful moment isn't when the larvae were removed. It's when father and daughter finally saw each other clearly, wounds and all, and chose connection over distance. Their Sunday dinners didn't erase decades of silence, but they proved something essential. It's never too late to start again. We don't need perfect families or complete healing to build something beautiful. We just need honesty, forgiveness, and the courage to keep showing up. What relationship in your life needs a second chance? Have you ever discovered that someone's distance was actually their way of protecting you? Share your story in the comments. Your experience might be exactly what someone else needs to hear today.